I can't think of a scarier term right now to have diagnosed than this is what's going on. The reason you have the headaches and the reason why you have these symptoms is because, oh, we've discovered a brain tumor. And then I start, probably, if a doctor says that to me, I start making arrangements. But as a result of people like Dr. Nader Sanai, we have less fear then, because of the fact that there's a lot of reasons why we can look forward to a full and complete life.
Well, absolutely. I think it is a scary diagnosis. It's not one that affects many people, fortunately, but when it strikes, it's something that alters your life, those of those around you.
How many?
About 60,000 new primary brain tumors. These are tumors arising from the brain itself rather than coming from other parts of the body, are diagnosed each year. About half of these are malignant in the general terminology. These are tumors that can affect the fabric of your being. They affect your ability to speak. They can affect your ability to see or think clearly. They change who you are bit by bit, and that's part of why it's so scary. And obviously the other part is that the life expectancy is very poor. These are some of the most fatal diseases known to man.
But we can be a little bit more optimistic now as a result of the new Barrow Brain Tumor Research Center. Tell me about the work that goes on there.
Well, I think at the Barrow you sort of have the perfect storm. You have very high clinical volume. It's one of the highest neurosurgical volumes in the world. On top of that, you have a modern research infrastructure, and then on top of that, you have the clinical expertise. So you bring these three together, and it gives us a possibility to generate translational research, research that focuses on basic science that will quickly translate to a clinical application or a clinical therapy. And that's what we're shooting for here.
Is it just my imagination, or does it seem that we hear about a disproportionate number of children who have brain tumors, children and adolescents?
Well, we are detecting them more frequently than we did before. And initially the fear was that there was something in the environment, for example, that was putting us at risk. And obviously there was concern about cell phones, for example. To the best of our ability, there is no legitimate link between cell phone usage and brain tumors. Here you see on the screen a brain tumor located in what's called the insula. And really our job here in this patient, and this is an illustration of a younger patient, is to remove this tumor to the greatest extent possible without affecting the patient's functionality, because quality of life is really one of the most important aspects as you're moving forward with this therapy. So you can see here that the bone is removed, and underneath that there's a lining to the brain called the dura. That's peeled back, and here you see the left side of the frontal lobe and the left side of the temporal lobe and some vessels in between. And what we do in patients that are sometimes awake during the operation, actually, is we test the function of the brain before we go in and remove the tumor. So we identify areas corresponding to sensation, to motor function, meaning the movement of your mouth or arms. And then we actually, in certain patients, keep them awake and we test their language function. We ask them to count numbers. We ask them to name pictures. We ask them to read words. And this all gives us a very specific map of what's going on in this patient's brain, so that what we can do is preserve these areas and then remove the tumor in its entirety to the best of our ability and with as much safety as possible. Because as much as we try to be aggressive at the Barrow and at most major brain tumor centers, we're also very, very concerned about the patient's functional lifestyle afterwards. We want them to leave the operation just as functional or perhaps more than they entered. So
that's an astounding procedure.
It is a sight to see a patient with his brain exposed and speaking to you at the same time.
And yet we also hear about seizure victims who have a series of seizures that makes them almost incapable of normal life, having large portions of their brains removed and being able to function as normally as anyone who has never had a seizure problem or brain surgery.
Right, so the brain is an amazing organ. It's able to adapt. It's able to have a certain amount of plasticity. So if you remove these seizure foci, even if they're large areas like you suggested, your brain can sometimes compensate for that.
So who is it that right now would be considered an at-risk individual, age, race group, nationality?
Well, we know that it affects all ages, races, and nationalities.
Equally?
Almost equally, yes. The most common age groups for diagnosis of a primary brain tumor are in your 40s and 50s. That occurs across nationalities, across ethnicities. We know risk factors include a lot of radiation to the skull, and back in the 40s and 50s, patients received radiation to the skull for things as mild as head lice, not knowing that there would be this kind of consequence decades later. So we see patients like that not infrequently.
When would I know that it's time to call you?
Anytime you're faced with a new neurological deficit, so that can include a seizure, sudden onset of severe headache, sudden onset of new functional difficulty, an inability to get the words out, an inability to certainly see certain parts of the field. So all of these things obviously will come to your attention. They're not difficult to discern, but hopefully they can also be addressed without having a brain tumor.
You know, rarely do I have to ask a respected surgeon such as you, a specialist in your field, doing the kind of work that you do, about where the money comes from, because that's usually another office. But you've got a remarkable organization doing some remarkable things with this health and wealth raffle. Yeah. How important is that to you in your work?
It's critical. It's essentially life-saving, because the national scene has changed dramatically in the last 5 or 10 years. We're seeing a dissipation of federal funding for a lot of the most critical research projects, particularly in brain tumors, where it's essentially been decimated at the national level. So we're seeing a shift from national to local efforts, and that's really the motivation behind efforts such as the Brain Tumor Research Center at the Barrow. And we can't do this without local support, and the Health and Wealth Raffle is probably one of the nation's preeminent examples of that.
So does it buy equipment? Does it buy additional surgeons and staff?
All of that. It buys equipment, research space, research supplies, the ability to hire the right personnel, the human resources that go into these efforts. And the most amazing thing about it is that these dollars come directly to the laboratory rather than being filtered through many, many intermediaries where it gets whittled down. Okay, well, there's a family out there right now whose voice I can hear. They just came here from Altoona, Pennsylvania, and said, "That's great. How can I contribute? What can I do? What is that raffle thing? And are there prizes?" And you know what? I am so glad you got here in time to find out, because that's the next segment of the McMahon Group, all about Barrow, about the Brain Tumor Research Center, and about a big house and a big car and lots of other stuff.